So hello, my name's Lance McCarthy, Chief Executive, and I've had the absolute pleasure of spending just a little bit of time today with some of our amazing practice development team. So Shika and the team, they're about to talk you through the journey and the support that they provide to all of our new nurses and all of our new healthcare support workers. But first, if they introduce themselves, and then they'll tell the fabulous story of all the support that they provide.
My name is Shika. I'm the practice development nurse working in emergency department. I work very closely with the trust team as well.
So I'm Rama Sankaran. I'm one of the clinical practice educators and I'm covering all the surgical wards.
My name is Tanisha Calhoun. I'm also one of the educators here in the trust.
I'm Crystal Fraugo. I'm the International Nurse Educator and Manager.
So my name is Vanessa Botray. I'm the Healthcare Support Worker Educator and currently the new lead for the practice development team.
When we identify the nurses that will be joining our trust, so basically the first part of their journey is with me. So as soon as we know their names, we get in touch with them even before they arrive the country. I set up WhatsApp groups. I contact them to make sure that they're all okay, well-being wise, and also we have webinars to explain what to expect when they arrive in the country. And my main role really is to make sure that they adapt and adjust in our workforce, and also to ensure that they pass the Part 2 test of competence to get their NMC PIN. So that is the OSCE bootcamp training that we have for 4 to 5 weeks there with me during that time. And also, it's not just an OSCE training, it's also to help them settle in the UK. So I provide kind of like a 24/7 pastoral support to make sure that they're all well supported. Because it is hard to adjust into a different country. I think we're all international nurses and we all feel what they are all feeling. And I always make sure that they have a positive experience when they first arrive, because first impression always lasts. So I've been doing this for the last 3 to 4 years now, and I had about 400 to 500 nurses come through me at that time. We've received very, very good feedbacks. We've received awards as well from the This Is Me program, and all of those culminated into receiving the Pastoral Care Quality Awards last year, which I'm very, very proud of. Yes, thank you very much. And I'm really grateful for all the feedbacks that we've been receiving, because one of my main priorities is the well-being of the nurses. However, there has been challenges from last year. It's been quite difficult. We had the recruitment we did last year was doubled compared to the other few years, and with the space we have, so we normally do our trainings in here, and also we have limited resources, but with the support of my team members and also the determination of the nurses, we did very well with the OSCE training. Also, the OSCE training at the beginning of last year has become very more difficult compared to the previous years. National average at that time was 20% passing rate. In fairness, our trust was still about 40 to 60%. So obviously my aim was to increase that. And I'm very proud to say that the last cohort had a 91% passing rate. Yes. Still, higher than the average, national average is still about 40 to 60%. So I'm very, very proud of that number. And I continue to obviously help and support the nurses because I feel like, if our nurses are physically and mentally well, obviously that will reflect on how they look after our patients. They will be able to provide the highest quality standard of care. So yeah, that's mainly my role.
They facilitate the nurse induction program. It's a 5-day clinical simulation program where we follow a patient's journey from admission to discharge. It is mandatory for all newly registered nurses, whether they are UK trained or they were from overseas. So this journey is their first-hand experience of the clinical areas. So it's all about simulation. So we simulate admission process, the discharge process. They actually have to do it. They have to do the full simulation programs. So it's where they get the first-hand knowledge of what they are expected to do on the wards as a nurse. Also, we have been incorporating other departments as well. So the medicine safety management, we bring in like frailty department. So they are not just aware of what they can do as a nurse, but the different departments of who they can refer the patients to if needs be. We have incorporated this induction program. It's very good in the sense that it allows all the nurses to come together in one area for that protected 5-day period, and they meet each other. Because as UK trained nurses, they may not know that, oh, this person was recruited. So it's a time where they can meet everyone. We also bring in our need for PNA Silver to do a RCS session with them, which is also very good. That's where you get to know their you'll get to understand their mindset and just to encourage them to enhance the skills that they have. Also, we do this because we want to let them know or be aware of our trust values. Because in everything we do, it has to incorporate the trust values, our goals, our missions, so they understand why we do this particular skill that way, why we do this particular skill that way. Because bearing in mind, we are all nurses from overseas, so we have learned how to do certain skills a certain way from before. So now that they are here, we have to let them do it in use our trust values, our trust goals, and our trust mission to carry out that skill to ensure patient safety.
My role as a clinical practice educator is I ensure that they get the basic clinical competencies and core skill competencies. We do different workshops, including catheterization workshops and nutrition workshops, and the TPN workshop, and also workshop for IV studies, and also venipuncture cannulation. So all these five, they are like mandate for all the registered nurses in our trust. So this is where they come to know, as Tanisha mentioned, though they have gained the skills or knowledge back home, where are they coming from? However, we have to make sure they get what the NMC standard is and what is our trust policy says, and because we have to adhere to our trust policies and NMC as well. So that is where we make sure that everybody is on the same page and they're able to gain that skill, and we provide them the initial theory bit and also give them adequate time to practice in the clinical skills labs in learning all day. We have got a few mannequins for the catheterization, so they get a chance to actually do hands-on sessions.
So my role actually is a bit different to them in terms of I'm specifically based in emergency department, and I have one more colleague who works in emergency, Elizabeth. She's actually the clinical practice educator. So we have a small team in ED, but then we are part of the practice development team. So my role starts once the nurses and healthcare support workers are in the department. So we offer them another 4 weeks of supernumerary period where they work alongside us and the staff to understand the nitty-gritty of how the department works. So, I mean, I will be using emergency department more because I work in there and I'm proud to be working in there. So when they start the whole 4 weeks, we work with them. We have an induction program for them specific to the ED standards, which are nationally recognized. And we spend days with them where we show them around how the ECG machine works, how you do an ECG, how they actually take offs for the patient, how they communicate with the patient as well. So that's how they work. As I said, the CPUs there work more closely with them. My role become more in developing the plans in terms of their development. So I offer the career development program. So from Band 5 nurses who have been in the department for almost around 2 years, who wants to now progress. So the research actually shows that especially in terms of the internationally educated nurses, the NHS England did a research where they identified that 90% of the nurses, I think they took the data for 600 nurses who are internationally educated from different parts of the world. And 90% of them, the motivation for them to migrate to UK was career progression. And that's why we have now got a good, robust program. So those who are Band 5, we help and develop them into progressing to Band 6. Those who have been Band 6s, we help them to develop and progress to the Band 7s. So we are also liaising very closely with the Learning and Organization Department, with offering some leadership programs and also signposting them to the various NHS academies which are offering those programs. We also make sure that whatever support we are providing, we are also giving them the protected time, because that is also important. We don't want them to do it in their own time, because that's very important. Also, I think as a team, as Rama said, that our role is also to support each other very well, because our team is really fluid and flexible when it comes to identify and support the department. But we also need to make sure that we support each other as well. So that's where we make sure that we have our regular catch-ups with each other. And also we do something called payday dinner. So every day when we have our salary in hand, we go around out of the after our work, so that we have some time, just the downtime, to make sure that our well-being is also taken into consideration. Because I think we all will agree that if we are well and healthy, we can support the nurses and we can support the department. And another part of our role, which is again applicable to everyone, is supporting the nurses in career coaching. So everyone, when they are looking for interviews, what support they want, we are the one they come and approach us. So we help them in doing mock interviews. We have a plan in how we support them. So we do mock interviews with them. We help them in making the supporting information, all of those areas as well. Also keeping in view of the PH 2030 vision of having the digital transformation, we as a team have developed our induction booklets now digitally. So we don't give them any paper, it's all paperless. So Tanisha has worked really well in terms of designing that. So am I. I have in ED, we share all that information in a Padlet form where it is accessible, easily accessible to them, and it will stay with them forever. So whatever they need to do, they just have to open their phone and everything will be very easily available to them as well.
One thing I'm also proud of as a healthcare support worker educator that I started for the HCAs is developing the HCBRE program for them. So it's like preceptorship for nurses. So I found a gap that when the healthcare support workers come in, there's not much support or there's not following up of training. So instead of the nurses, so people were complaining it's just the nurses that were receiving that support and all of that. So I just developed the HCBRE program, also preceptorship program, where we have various courses about how to learn about the ECG, bladder scan, the speech course involved. So the speech talks about bedside emergency. So how to be able to identify when there's a patient that's unconscious or in a medical emergency and what they can do to help that patient. So I involve various teams to be able to come in there. The PNA is also involved to talk to them about resilience and how to be able to because being an HCA or being a healthcare support worker is very hard in the wards. So it's just talking to them about how to be resilient and how to be able to communicate or talk to people and then express their needs or express what they're also going through as healthcare support workers, because they don't really have a forum to be able to talk about all these things. So the HCBRE program provides them with that kind of space or forum to be able to come and speak about that. They get to meet people from other departments of various wards. So everybody has different unique experiences that they're going through on their wards. They tend to share that and then they feel supported. So one thing that I got to know was they get to feel supported to say, okay, so this is what you're also going through on your wards. I'm happy to hear this. And then they're able to learn and pick up from each other. Our first cohort was done in December, and we are having our second cohort currently ongoing. So, yeah.
Fantastic. Well, can I say a massive thank you to all of you? I mean, not you clearly, and I think there's another 4 colleagues as well as part of your team. You can feel the energy and that passion and the inspiration that comes from all of you, and you can feel that you actually properly work as a team and you support each other, which is absolutely amazing. But a massive thank you for telling the whole journey and the whole story from healthcare support workers and newly trained colleagues coming from overseas all the way through to support them into the organisation, support their training, their development and their career progression. You clearly also provide masses and masses of support and health and wellbeing support, as well as the professional support. So a huge thank you. It must be hundreds and hundreds and hundreds of colleagues that you're supporting every single month. So massive thank you. Thank you for all the hard work that you put in, and you genuinely are truly inspirational. So thank you.